Fight against the virus is Dr. Anand Swaminathan. Thank you so much for joining us again here on BNC. Doctor, you heard the report there. Also this week, Cornell University closed campus and shifted to remote learning after reporting over 900 cases of the virus among students. How are they going to figure out whether people have Delta, the regular version, or Omicron? What is the process now? Because we have all these variants and it's getting confusing for people and you just really don't even know what you have. So when you hear something like this, how do they sort through this to decide or figure out what people have?
Well, we don't usually do it on a individual basis, but more on a population basis of seeing what variants are circulating at that time. Right now, the CDC has released a ton of information telling us that Delta is the predominant variant that is being sequenced at labs. That is what is the dominant strain right now in the US, with Omicron starting to peak up in areas where I live, like New Jersey, New York. That's about 13% Omicron overall. Most of the country is much lower than that, but that is going to start to rise. We can see what's happening in the UK, in the EU, and we know that we're about 4 to 6 weeks behind them. So we expect that Omicron will start to rise and rise over the next 6 weeks. Whether it becomes the dominant strain or if Delta and Omicron go back and forth, they share this as a dual variant in the pandemic, we don't quite know yet. The good thing, though, is that the same things that we do for Delta, we should be doing for Omicron. Get vaccinated, get boosted, get your kids vaccinated, and then the public health initiatives that we have been pushing and touting all along. Wear masks, avoid indoor spaces with people that you don't are not in your household, and then test if you have symptoms to make sure that you're not spreading it to other people.
So we do hear that all the time, of course. The main thing is get the vaccine. But we know, of course, there's still people who simply don't trust it. They're concerned. It's been a year now since the first vaccines were distributed. Has anything come out, any type of research that says, hey, we've learned this, you shouldn't fear it because, it's been a year now and we've learned that it does X, Y, Z. Is there anything that they can share? Because I feel like they don't say anything about what they're doing. I mean, in terms of, we've tested, we've seen these people who have had the vaccine and they're okay, because the big thing is getting people comfortable with it.
Well, like you said, we're a year out now. I got my first vaccine on December 18th, 2020. We're a year out. We have a ton of data from billions of doses of vaccine that have been administered, telling us that overall the vaccines are extremely safe and that they are our best protection. You mentioned up top 800,000 deaths in the US. That is a numbing fact. It's something that kind of takes our emotion away when we need to break it down a little bit and understand that's one in every 400 US citizens have been killed by COVID over the last 2 years. And when we look at different age groups, that's one in 100 over 65. 65 isn't that old. That's people's parents, that's people's grandparents. We know that those are primary childcare providers for many kids, which means that a lot of kids have lost their primary caregiver through this pandemic. We're just talking about in the US. We need to understand those numbers and not be numbed by them. Yes, vaccines have side effects. The vast majority of them are extremely minor. You feel a little bit achy, your arm hurts, maybe you get a little bit of a fever for a day or two. COVID is much different. Yes, there are lots of people who get a minor symptoms from COVID. They recover quickly, but we're talking about 800,000 people who have died as a result of this disease. And over the last 6 months, since vaccines have been available to every American, we have seen hundreds of thousands of unnecessary deaths in the unvaccinated. It's hard to really express the frustration that we feel in healthcare seeing people turn down vaccines. This is the best way for us to protect ourselves, to protect our community, and to get out of this pandemic.
Well, we really appreciate you breaking that down because it is difficult. And I know for you to share your frustration, I appreciate that. And we do appreciate everything you health providers do. So I hope you do get that message from people, despite the fact that there's so many people who still doubt. We know how important it is. Thank you so much for joining us, as always, Dr. Swaminathan. Take care.